Throughout history, infectious diseases have shaped human civilization, causing widespread suffering and death. Some outbreaks have wiped out millions of people, leaving lasting impacts on societies. Here are 10 of the deadliest infectious diseases in history. 1. The Black Death bubonic plague. One of the deadliest pandemics in history. The Black Death ravaged Europe, Asia, and North Africa between 1347 and 1351, killing an estimated 25 to 50 million people, caused by the bacterium Yersinia pestis and spread by fleas on rats. The disease led to the collapse of societies and economies. 2. Smallpox. Smallpox, caused by the variola virus, was responsible for approximately 300 to 500 million deaths in the 20th century alone. The disease, characterized by fever and painful pustules, devastated indigenous populations in the Americas after European contact. A global vaccination campaign led to its eradication in 1980. 3. Spanish flu. 1918 influenza pandemic. The 1918 influenza pandemic, caused by the H1N1 virus, infected about 1/3 of the world's population and killed between 50 to 100 million people. Unlike typical flu strains, it primarily affected healthy young adults. The rapid spread was exacerbated by World War I troop movements. 4. HIV. AIDS. Since its discovery in the early 1980s, AIDS has claimed over 40 million lives. The virus attacks the immune system, making individuals vulnerable to infections. Despite advancements in treatment, it remains a major global health challenge, especially in sub-Saharan Africa. 5. Tuberculosis. TB. Caused by Mycobacterium tuberculosis, TB has been a persistent killer throughout history. It primarily affects the lungs and is spread through airborne droplets. In the 19th and early 20th centuries, it was known as the White Plague. Today, drug-resistant TB strains pose a major public health threat. 6. Malaria, a mosquito-borne disease caused by Plasmodium parasites. Malaria has killed millions, particularly in tropical regions. Although treatments and prevention efforts have reduced mortality, it remains a leading cause of death in Africa, especially among children. 7. Cholera. Cholera, caused by Vibrio cholerae, spreads through contaminated water and food, leading to severe diarrhea and dehydration. Several pandemics since the 19th century have claimed millions of lives, especially in areas with poor sanitation and limited access to clean water. 8. Ebola. Ebola virus disease, first identified in 1976, has caused multiple deadly outbreaks, mainly in Africa. With a high mortality rate of up to 90%, the virus spreads through direct contact with infected bodily fluids. The 2014-2016 West African outbreak resulted in over 11,000 deaths. 9. The Third Plague Pandemic. Between the mid-19th and early 20th centuries, a resurgence of bubonic plague killed over 12 million people, mainly in India and China. The disease spread via infected rats and fleas, exacerbated by poor sanitation and rapid urbanization. 10. COVID-19. Caused by the SARS-CoV-2 virus, COVID-19 emerged in late 2019 and quickly became a global pandemic. It has led to millions of deaths worldwide, overwhelming healthcare systems and disrupting economies. While vaccines and treatments have reduced mortality, the long-term effects of the disease are still being studied. These diseases have shaped human history, highlighting the importance of medical advancements, hygiene, and global cooperation in combating infectious threats.